This week is International Osteopathic Healthcare Week, which runs from May 2nd to 8th this year. It aims to bring together the global community of osteopaths and osteopathic physicians to celebrate and promote osteopathy, with this year's theme being Move Better with Osteopathy. In the studio today, I have our regular health man, Dr Paul Hermann, who is an advanced sports osteopath and advanced exercise rehabilitation osteopath, giving us some insight into what an osteopathic therapist does, as well as some of the common injuries people see osteopaths for. Firstly, big congratulations on your new additional title, Advanced Sports Osteopath. That's epic. You are now officially the first double-titled osteo in Australia. That's a massive accomplishment. So what does that actually mean now for you professionally?
Yeah, thank you. It means that if people are searching for an osteopath, we have this advanced credentialing title pathway now that recognises osteopaths who have done additional training or sufficient additional training in one specific area. So if you're looking for a paediatric osteopath, you can go to Osteopathy Australia's website, and under the Find an Osteo section, you'll be able to find an osteo that is titled as a paediatric osteopath. And the same for a sports osteopath, advanced exercise rehab osteopath, etc. It's recognition of those people who have done additional training in those specific areas.
So it's more specified now, and having that extra title allows you to work more broadly with people, or specialise even more in people with certain injuries. Or
it's basically more that following our standard training at university, we come out as general osteopaths, and of course we treat all sorts of conditions, all sorts of areas of the general population. And people find areas that they have a stronger passion in. For me, that's been exercise rehab and sports. For others, it's pediatrics, or it might be persistent pain or occupational health. It's enabling us to get recognition for the additional training we've done in that area to help the general public find osteopaths who have done additional training specifically in that area.
Yeah, especially if they've had multiple injuries, or they want somewhere. Yeah, it makes sense. I think it's great. I think it's awesome that you've been recognised, and it's great that you hold a double title in Australia too. Can I ask, given that it's International Osteopathic Healthcare Week this week, would you mind explaining what an osteo does, what they focus on, and what are some of the common injuries and reasons people see an osteo for? Because it is a lot of people say to me, oh, what does an osteo do? You know, is it the same as a chiropractor? Isn't it the same thing? And I'm always kind of going, no, but I really don't know how to answer it. So,
look, neither do I, and after nearly 20 years of practice, I graduated in 2001, so yeah, this is coming up to my 20th year in practice this year, and I still don't really know how to answer that question. It's probably the most common question. It's the $1 million question we get. When I first graduated, I was registered number 329. So there wasn't many osteopaths in the country.
329? My gosh.
The most common question I got was, what was an osteopath? What is an osteopath? I have no idea what you are and what you do. Now the most common question is, what's the difference between an osteopath, a physio and a chiro? And both are equally challenging questions. The first thing I'll say is, I can't really answer what a physio or a chiropractor does on a daily basis. I've never been a physio or a chiropractor. And I can't even necessarily answer what every osteopath does, because I'm not every osteopath. And there is as much difference between osteopaths in terms of their day-to-day as there probably are between some physios and some osteopaths. What I can answer is the general approach of osteopathy, the philosophy. It is a mix between philosophy, art and science.
Okay,
and it is a holistic approach to health that we deliver usually via manual therapy, lifestyle advice, exercise advice, and generally helping people improve the way they function and the way they feel. And that's what I can say about osteopathy. How it's applied is variable. It's variable between osteopaths. Some take more of a hands-on approach, some take less of a hands-on approach. But the philosophy is still quite the same, that we want to empower patients, we want to educate them, we want to help them improve the way they move and function, or as I say, colloquially, the way they move and groove.
The way they move and groove.
Yeah, we want to get people functioning as best as possible so they can have the best health as possible.
Well, that makes a lot of sense, and I also think that some of the physios and osteos, and I'm not sure about chiropractics because I don't necessarily see a chiropractor, but I do feel like it's they're not two dissimilar things, because they're both, or you're kind
Look,
of
it's
like,
really hard. It comes down to the practitioner.
Yeah,
As I
yeah.
say, it really does depend on. There is some fantastic osteopaths, chiros, and physios out there, and I'm sure, like every profession, there's variable levels of excellence within the profession, and variable levels of approaches and variable philosophies within each profession. So one thing I will say is that Stay Tuned Sports Medicine, where I work, we have osteopaths and physios, and they're very similar in their approach. They might deliver the techniques or deliver the therapy slightly differently, but their approach, their philosophy, our intention is the same. And again, I can't speak for other physios, other chiros, or even other osteopaths. That's just our approach there.
and you look at the body as a whole, not just the specific element or injury.
Very much so.
But I've noticed athletes are more commonly using osteopaths as part of their recovery, as part of their, injury rehabilitation. What are the benefits of seeing a sports osteo? Because you've got a lot of athlete clients.
Yeah, definitely. Look, it's an area that I have a strong passion in, and there are several titled sports osteopaths in Australia. So if people are looking for an osteopath that is specifically additionally trained in sports, that's what they can do, is go to Osteopathy Australia's website, find an osteo, search under that to see an advanced titled sports osteopath. Most commonly, the reasons that athletes will come to osteopaths is quite similar to why they would go to physios or to chiros. It's from our training, it's an extension of the philosophy. We do look at the body in a holistic way, and we get them back to their best function. In sports, we're just extending that, rather than it being to their best function, to their best performance. We're trying to improve and enhance their performance via the functioning of their body in the best possible way.
Because because obviously you've been my osteopath for a long time, and a lot of the time, exercise programs are a big part of their recovery, especially if they're coming back from an injury or they've had surgery, which makes sense why more and more athletes are preferring to use an osteopath as opposed to a chiropractor.
Yeah, maybe. And it's also, and I say this with all honesty, it's also a matter of numbers. Again, when I graduated, I was registered number 329. And I'm not sure how many osteopaths there were in Australia, but I can only imagine there was only a few hundred at the time. There's now a bit over 2,000 osteopaths in the country. Comparatively, we're still very small. Even though we've grown substantially, we're still a very small profession. I think, and don't quote me on this, but I think there's about 28 to 29,000 physiotherapists, as an example. But yeah, we are a small profession. I don't know how many chiropractors there are in the country, so I won't suggest a number there, but I know there's a lot. And comparatively, osteopathy is a very small profession compared to those. But we are starting to see ourselves more and more in sports. We're seeing osteopaths in professional sporting teams. We're seeing osteopaths in elite level athlete development. And it's just fantastic as those career opportunities continue to open up for emerging osteopaths coming into the field and coming out of university now.
Would you say the primary reason for osteopathic care or seeing an osteopath is to, be able to move your body in more functional ways as you age? Because I know it's important. Movement is very important as you get older, which was going to be my next question. And is seeing an osteopath, if you're fairly active but you're over 65, is it a good therapy to kind of continue your mobility and flexibility and I guess agility as you're aging as well?
Look, obviously it's a biased answer. I'm an osteopath, so I think everybody should see an osteopath.
Yes, they should.
But yes, certainly can help people of all ages. I'm not a pediatric osteopath, so I won't treat kids because I'm not trained in that area. There are trained osteopaths, pediatric osteopaths, again, who are titled in that area, who can see that age of patient. But generally speaking, we see people of all ages. I've got patients who come and see me in their late 80s and early 90s who may have degenerative processes, pain, stiffness, sore lower backs, headaches, etc. and they want to function and they want to continue to function as best as they can. And as is the theme this week with Move Better with Osteopathy, it's Move Better with Osteopathy through your whole life cycle. So whether you're an Olympic level elite athlete or whether you're a 90-year-old who just wants to keep moving and dancing in their kitchen, we can definitely help those people, and that's what we're here for.
Yeah, no, I think it's important, and I actually quite like the fact that osteopaths actually have a variety of different treatments. It could be anything from dry needling to massage to, gentle manipulation or whatever it is, and other stuff that you do that I don't really know. But I think that kind of works a lot and can be individualised to everyone depending on what their needs are.
Certainly.
And finally, what important advice can you give us today about keeping our bodies moving and injury-free?
Ooh, that's $1 billion question. Along with that theme of move better with osteopathy, I think the thing is to keep active. Keep active in any way you can. I tell so many of my patients, look, just literally put on some music and dance around. And I don't care how you dance, obviously make sure it's safe and you're not going to slip over and injure yourself. But however you want to move, however you want to groove, your body is designed to be mobile. It's designed to be active. We're not designed to be in this static, loaded positions that we find ourselves in, sitting all day in front of computers. We have these things now. We can do sit-to-stand desks. We can get up and get moving. Do whatever you can, however you can, and be as mobile as you possibly can.
I think that's key. Being active is so important. It's important for so many different reasons, but I think in terms of mobility, my dad is nearly 70 and he's so active and he's healthy. He never really complains about anything. His joints are all still good, and I'm pretty sure it's because he moves a lot.
There is that old saying, move it or lose it, and it's really true. And then obviously, in terms of safety, if you're looking for a program that's personalised for you in terms of an exercise program or advice around exercise, that's when you want to go and see a health professional, be it an osteopath, physio, chiropractor. Again, I'm biased, I'm an osteopath, so I'm going to suggest go and see one of our great osteopaths around Australia. But if you're looking for something that's more personalised and specifically tailored to you, that's when you want to go and see a health professional. Otherwise, keep moving.
Like always, it's great getting your perspective, Paul, and thanks again for chatting with me about osteopathy.
A pleasure.
For more info on Dr Paul Hermann and his Stay Tuned clinics, visit their website www.staytuned.com.au or follow their socials at Stay Tuned Sports Medicine. And if you want to find an osteopath and you're not in the vicinity of Stay Tuned, jump onto osteopathy.org.au and you'll be able to find an osteopath near you.